Good evening, everybody, and welcome to our weekly Wednesday webinar series. Tonight, we have a topic that is very near and dear to my heart, as well as to other individuals with children with epilepsy. I know that my daughter's 17, and we're kind of reaching that age where we're thinking definitely about the transition at some point soon of her pediatric care with all her pediatric specialists to her adult specialist, and what is that going to look like, right? And how do I get her prepared, and how do I prepare myself for that? Because there's a lot of pieces to that. So tonight we're going to join all of us together to talk about that. And we are so lucky to have tonight Meghann Kelly from Boston Children's Hospital. She has graciously joined us tonight and has shared her time with all of us tonight, which is something that I always want to reiterate to everybody, that all our speakers are volunteering their time to be with us tonight, which is huge. So Meghann is from Boston Children's Hospital. She is a licensed clinical social worker in the Division of Epilepsy at Boston Children's Hospital. She's been there for about 7 years. Her education took her to her undergraduate degree in psychology at Emmanuel College and her graduate degree from MSW degree at Boston College. She has interests in supporting the psychological aspects of navigating life with a chronic illness, comorbid behavioral health conditions, educational opportunities like tonight, and advocates for patients and families impacted by epilepsy. Meghann is involved in multiple research and quality improvement initiatives in her program, including those related to quality of life, healthcare disparities, and depression screenings of youth with epilepsy. Meghann is on the transition committee focusing on transition to adulthood for youth with chronic illnesses and disabilities. So we are so lucky to have her here tonight. A little bit of some house cleaning tips, just to remind you. If you do have questions tonight, please put them in the chat. We will stop periodically when Meghann is ready to answer some of those questions, and I'll go ahead and read those to her. If there is a question that maybe needs a little bit more background, I will then ask you if you're feel comfortable enough to add a little bit more information to that question. And if you're not comfortable, that's perfectly fine. You can always put the information right in the chat. So without further ado, I'm going to go ahead and pass the mic to Meghann.
Thank you so much, Christine. Before I start, are my slides showing properly for everybody? Or are you seeing my notes?
I am seeing your notes.
Oh, geez. Okay.
Well, we're seeing the next slide. So we're seeing your slide to the next slide.
Yeah, so you're probably seeing my notes. I think, so sorry.
No worries. We are fine. This is a very comfortable group, so no worries.
I'm not the most tech savvy. I do have it in presenter view, but there should be a way for me to be able to see my notes without you all seeing
Hide
them.
presenter view. There we go. Perfect.
Okay. Now I can't see my notes, but that's okay.
Oh no.
We will hope for the best. Should be okay.
If it's more comfortable for you to share how you were sharing before, it's perfectly fine. We don't see your notes. All we see is the next slide coming. So I don't know if we see the notes, but whatever is easiest for you, Meghann. We are a very comfortable group. I don't think anybody is going to think anything different if you're sharing some of your notes with there, because I know you'll be elaborating. So it's perfectly fine. Whatever is easiest for you.
Okay. All right. We'll start with this, and if it feels too cumbersome, just let me know. Thank you.
You're very welcome.
So sorry everyone for the technical issues. I'm Meghann. I'm one of the social workers on the epilepsy team at Boston Children's. I'm super grateful for this opportunity to be with you all tonight. As Christine mentioned, this is a really important topic, and I'm sure very on your mind right now if you're here at this session. So thanks so much. As we're starting, I wanted to just kind of go over some learning objectives of things that I'm hoping that you all are able to kind of take away from tonight's session and walk away with. So I'm hoping that you will be able to understand that healthcare transition is a process rather than just a single event. I'm hoping that you'll be able to recognize the shifting roles of caregiver, adolescent, and the healthcare team. I'm hoping that you'll be able to identify some key skill areas for your adolescent to develop to aid in the transition process and or areas you as a caregiver may need to focus on depending on kind of your child's abilities and support needs. And then I'm also hoping that you'll be able to identify some tools and resources that you'll be able to use to support your family during this process. So just to orient us, um, just to kind of give you a guide of what I'm going to be going over. So I'll start with some definitions and kind of key concepts, and I will pause at that point to see if anyone has any questions. And then I'll talk through some developmental considerations and kind of an like example timeline of things to think about for when to be working on some of these pieces. I'll also talk about some skill building. I'll go through some tools, and then we'll have time for a larger group kind of Q&A. So before we actually get started, I just want you all to take a minute, take a deep breath, and just think about your child and the journey that you've been on with them so far, and acknowledge all the hard work that you've put in to get to this point. Um, think about how transition is making you feel, kind of what's coming up for you. Um, and then try to answer the questions. What is one thing that you want? One thing that you wish? And one thing that you wonder for your child as they're approaching this transition. I'm going to pull up the whiteboard um, where you'll be able to add if you would like to share some of your answers to this question. And I'm hoping that it'll help you all kind of see what others are kind of experiencing. Just have to figure out how to do that. I think I have to stop sharing my screen. So sorry. Take a moment to think about those things while I am pulling up the whiteboard. Okay. So whenever you're ready, if you would like, feel free to add a sticky note. You can use the pen. I think you can also type. If the whiteboard is not something that you like to use, that's completely fine. Feel free to put things in the chat. And we'll just take a minute for this.
If anybody is feeling a little nervous about adding anything into the chat, I mean, on the whiteboard, please add it in the chat and just start your question with either I want, I wish, or I wonder. And I am more than happy to copy and paste and put it on the board for you. So please, I would, we definitely don't want to limit anybody from participating in this wonderful exercise. So if whatever your comfortability is, we're happy to meet you. So just know that as well.
Absolutely. Thank you, Christine. I know that I had to practice the whiteboard before this meeting, so I understand. But Milagros, if you want to share anything, please feel free in the chat. Getting some really great answers here. Give just a few more minutes. Great. Seems like the additions have slowed down a little, so I will take a second and look at them. I think that you've all gotten to definitely a lot of things that a lot of parents feel at this point. So I'm hoping that this helps you feel a little less alone and hopefully alleviate some of the overwhelm that, this is a completely normal. Um, you're worried about um, kind of setting your child free in a sense to make all their own decisions and especially manage the medical care that you've been, on top of for them for their whole life. Um, Also wanting to have your child be able to advocate for themselves, develop confidence, develop independence. Those are all really, really great places to start. And, that's definitely something I want to emphasize tonight is being able to empower your adolescent, however that looks for them. Um, I think also seeing some of these, I want to know certainty that I'm making the right decision to switch over to an adult provider at the right time. I'm sure you've probably experienced a lot as a parent of things that you want to know certainty that you're making the right choice. And it's hard to know. I'm hoping that tonight will give you some things to think about to help you make the decision of the right time. Um, yeah, and wondering what life will be like uh, once your child transitions to an adult provider. It definitely might look a little different than how it looks now. That's hopefully tonight will give you all some ideas and some tools that you can use as you prepare. Um, Let me go back to sharing my screen. Um, Before I do that, actually, does anyone have anything else they'd like to add before we move on? This was really great. Okay, I'm gonna stop sharing the whiteboard. Go back to my slideshow. Okay, so hopefully you all will be able to kind of keep some of the things that you were thinking about in mind as we move through the material tonight. So next, I'm going to move on to talk about just some key concepts and like definitions to think about regarding transition. Um, so much like anything in your child's life that you're navigating, its transition is multifaceted. And so tonight we're going to be kind of zooming in on the specific transition to adult healthcare and adult provider. But I wanted to take a minute to acknowledge that your child will be navigating transition in a variety of areas, and each one of them could be its own webinar, probably. And I'm hoping that the supports that you have, that you're working with, will help you navigate some of these other pieces, like their educational and vocational needs, financial considerations, their community supports, behavioral health, legal decision-making needs. I will touch a little bit on some of these things because some of them do factor into this process of transitioning to adult care. But again, hopefully there are a lot of other resources that delve more deeply into some of these other topics, and some we will talk about towards the end as well.
And if you want, I don't mind sharing my slides that you gave me, your slides, and then you can keep yours on your computer and then use them as the notes. So that way they're just seeing the slides. And then you can let me know when you're ready to go to the next slide. I'll move to the next slide, and then you can just move your slides that are on your laptop so they won't see the notes.
Sure, that sounds good.
That's good. Okay, I just wanted,
Yeah.
just because so that the slide is larger so that people can actually see all the writing. I just want to make sure it's not so small. So
Yes,
everybody
that
can
is
see it
that
for you.
makes sense.
Okay, I'm pulling up the one that you gave me that was the most newest that you sent. And that's one of the reasons why we love when our speakers send us their um, slides so we can then pull it up for them. So I'll go ahead and move to the one that you're on.
Thank you.
Oh, my gosh, you're so welcome. That is why I'm here to help you. Just it'll make it easier for you too. And I don't want to believe we're on this one still. Am I correct? Or are we moving on to the next one yet?
Next one.
Perfect.
Awesome. Thank you. Um, so as I had touched on briefly, uh, there is a distinction between transition and transfer. So transition is a process, whereas transfer is kind of that single event. So transition to adulthood, as I said, covers a variety of areas. And so through whichever area you're thinking of, healthcare, education, living environment, uh, work environment, it's the process of increasing someone's independent self-management skills over time. And so that key there is the overtime piece. And so when your child enters adulthood, they won't just magically know how to do all these things. So it's something that needs to be proactively planned for, and should consider the child's specific developmental level and their support needs. And that's how you'll kind of navigate how they might develop the skills for managing their own medical care. Um, and we know that all adolescents go through this transition to adulthood and have different milestones to meet. But for our patients and kids with epilepsy or other chronic illnesses, there are some additional skills and kind of benchmarks that they need to be aware of and manage, to maintain their health and safety. I also want to acknowledge too that we know that epilepsy affects everyone differently, and kind of our patients exist on a spectrum in the sense of, their level of support that they need and require. And so throughout tonight, the purpose here is to kind of give some general guidelines, but it really is a personal process that will be tailored to your child and your family. So I just want you to keep that in mind. So the next slide. Um, so specifically thinking about healthcare transition. Um, so healthcare transition, this is a definition from Got Transition, which is a resource that we will include later on tonight, that has a lot of good tools. Um, so healthcare transition is the process of moving from a child and family-centered model of healthcare to an adult patient-centered model of healthcare, with or without transferring to a new clinician. And so some of this sort of healthcare transition stuff will still be happening while you are in the comfort of your pediatric setting before actually moving on to the adult setting. Um, Ideally, it involves planning for transition, the actual transfer, and then the integration into adult-centered care. And ideally, within that time frame, youth are improving their ability to manage their own care and effectively use health services. Ideally, this process with enough planning is done in an organized way, but as we know, not everything works out perfectly, and that's completely okay. So moving on to the next slide. So this is just a nice visual. I recognize that maybe not all of you taught your child to ride a bike. They may not be able to ride a bike in this way, but it is just a visual to kind of illustrate this idea that transition is a process, and it illustrates kind of the shifting role for you as the caregiver. Starting out with your child completely dependent on you, and to get them from point A to point B, so to speak. And then their kind of own independence and wishes and desires sort of grows, as they start to be able to ride the bike on their own, and eventually they're riding alongside their caregiver. And so again, this may look different depending on the level of support your child needs, but the kind of overarching idea of this is that it's a process. It doesn't just happen overnight. Um, and the goal is to empower and honor the autonomy of your child as much as is safe and feasible within their capacity. So moving on to the next slide. 18 is kind of that magical and maybe a little scary number for some of you. Um, so I wanted to take a minute to talk about what happens at 18, because that is when a lot of the kind of legal shift happens. But ideally, a lot of this kind of skill development and transition planning will be happening well before age 18, so that you're prepared. So moving on to the next slide. So the kind of key piece of turning 18 is that when someone turns 18, the law assumes that they are an adult that is going to independently take care of themselves and manage their healthcare decisions. So before 18, you as their parent or guardian have the responsibility and the right to be the decision maker and managing care. However, as of the 18th birthday, this power shifts to your child. And so this is going to happen whether you're ready or not. So it's important to be planning for it. And they become responsible for managing everything: healthcare, education, social decisions, financial decisions. Um, Moving on to the next slide. This just illustrates, sorry, Christine, this one is like, yeah, a stepped one. So this kind of illustrates how that communication and information sharing might change as it relates to healthcare. Um, so as you can kind of see in the graphic on the left, for the patient under 18 years, the communication is, with the parents and patient and the healthcare provider. This then will shift when they turn 18, that it's really focused on being just between the healthcare provider and the patient. And the parents are still there, they're still involved, but they're more of a supporting role. Again, this is going to vary a little bit depending on the level of support that your child needs and the situation that's right for you all. Um, but something to kind of think about that's a natural part of child development is, you know, the kind of developmental milestone in this age range is that adolescents are trying to develop their independence and their identity. Um, but, you know, they may want more independence and responsibility, but they don't quite feel like adults yet, and they still benefit from and may need some parent support. So it's helpful to kind of think about this as, you as the parent or caregiver are available as a partner, a collaborator to support your child and help them process their decisions, but not necessarily making the decisions for them unless that's the legal arrangement that you ultimately end up in, which I'll talk about in a second. Um, Something that will also happen is if you use the patient portal when your child turns 18, you'll usually lose access as the caregiver. So something just to be ready for. Um, Moving on to the next slide. This is just kind of a graphic that I made to try to show some of the different levels and options regarding decision making. Um, some of these have some more legal nuances. So I'm not going to get super in depth with them tonight, but if there are questions, I can try to answer them. And there are definitely some resources out there. I'm not a lawyer. I want to just preface that. So for some of this, it's helpful to consult a lawyer. But just from, my clinical experience, I can speak to that. So starting with kind of the least restricting option that the person is maintaining their most independence would be when your child turns 18, that they sign a release of information for you to be able to continue communicating with their medical team if that's something that they would like. Um, as I mentioned, the law is going to just assume that your 18-year-old is making their own decisions unless there's another plan put in place. Um, Another option is called supported decision making. Um, this is kind of an emerging option that's emerging as an alternative to guardianship. Um, we know that it's typical for adolescents to need some level of support, and some adolescents may need a little more support than their same age peers, but they may not need a guardian. Um, and so supported decision making um, involves the person choosing kind of a team of trusted individuals to help them with their decision making. So it's not necessarily a legal process. It's something the supported decision making website has like example forms that you can use and kind of talks through what the process is. The legal piece with this is that there are a few states that have signed into law um, laws around supported decision making that uh, help it kind of be a more recognized alternative to guardianship. So one of the bills proposed right now for Massachusetts would require that judges consider supported decision making before like approving or granting a guardianship. So that's just an example. So within the supported decision making, to be able to use it as, an option, there are tools that you can use within that. So the healthcare proxy is one, which everyone should have a healthcare proxy. Um, so that would apply also to, maybe someone that isn't using supported decision making. Also, the release of information can fall under here, and even a power of attorney. So it's definitely it's a supportive option, but it's not as restricting as a guardianship. Um, a power of attorney does not involve the court system. You can consult a lawyer. This is something that the individual would choose a person to be their power of attorney. There are powers of attorney for finances and health. They're separate usually. And the piece with this is that it's in effect when the person is not able to make decisions for themselves. So they need to have the capacity to appoint the healthcare power of attorney or financial power of attorney, um, you know, in order for it to be in enacted. Um, and that said, because they can choose who the person is, they can also revoke it at any time. So it can be a really great option um, for teens that need a higher level of support, but maybe don't need a full guardianship. Um, the final option is this guardianship, which is a court process, and it's when the court has determined that someone is incapacitated and is in need of a guardian to help them meet their needs. And even within guardianship, there is a limited form of it because the courts and the overall goal is to be in the least restrictive arrangement as is safe and feasible. And so really trying to balance this least restrictive option with safety while honoring your child's autonomy as much as makes sense. Um, and so moving on to the next slide, I want to just go over this distinction a little bit because I think sometimes these terms can get used and confused. And this will apply on the timeline that I am going over in a few minutes. So competence versus capacity. So competence is a legal state. It's not a medical one. And it refers to the degree of mental soundness that's necessary to make decisions. So all adults are assumed competent unless a court determines they are not. So this is a judge's decision, and this would be for your child, this would be through the guardianship process. Whereas capacity is defined as an individual's ability to make an informed decision. And so capacity is what the medical team, what a psychologist might be assessing when it comes to the idea of transition to adulthood in regards to potential concerns around decision making. It's really important also to note that decision making and support needs are based on so much more than just IQ, looking at someone's adaptive functioning, their abilities to take care of themselves. It's not this black or white situation. So it's really important to work with your child's healthcare team to discuss some of the options and whether there are any concerns about capacity. And yeah, we can move to the next slide, Christine. Thank you. So this is one section that I can pause for questions. So takeaways for decision making are that it's a shared process. Your role is shifting, but you're still involved. It's important to highlight your child's strengths and empower their autonomy. Before I move forward, are there any questions at this point?
Can I ask a quick question? Can you hear me?
Yeah.
So when you say the shared process, are we involving the existing neurologist, a child's PCP, as well as the parents to transition, or who
Yeah.
exactly is part of it?
Yeah, great question. So I'm going to get into some of the more like transition process meat in a minute. So you're setting me up well. When I say it's a shared process regarding decision making, I'm focused right now on the fact that when your child turns 18, it's expected legally that they are making all their decisions by themselves. But we recognize that rarely is an 18-year-old ready to do that suddenly. And so their process of kind of developing their decision-making skills is going to be a collaborative effort and shared amongst their trusted people, which may be you, it may be their primary care doctor. Um, and it's also going to be within their abilities and skill set. And so some adolescents may need more support, which gets at, maybe guardianship than others. So that's kind of what I mean. But I am going to get at like who else is involved in transition in just a few minutes.
Excellent. All right, thank you.
Mhm. Okay, I will keep going then. So moving on to the next section. So now we're going to actually get at the transition planning. So some things to kind of keep in mind about the process of transition. So as I had mentioned, adult healthcare setting is going to shift from that family-centered model to this really like patient-focused model, which I'm sure, as adults who have probably gone to the doctor, you understand, that kind of model and approach. Um, the focus is more so going to be on the medical management of that specific specialty. So whether it's neurology or if your child has kind of multiple specialties that they see, um, there's less access to some of the multidisciplinary resources and less wraparound support. In the pediatric setting, um, there might be a lot more like close follow-up, close referrals to like having a nurse check in on you about, a seizure action plan or a medication, or a referral to social work. So there's just a lot more of that kind of wraparound care. And a lot in the adult world is the onus is put onto the patient or the patient's guardian to be initiating outreach. Um, so it's really important during this transition planning time to think about skill development for your child, identifying the goals that they have for their healthcare and like kind of what they want for their adult care, kind of what kind of provider, what that might look like, as well as connecting to community supports ahead of the transfer, which I'll talk a little bit more about community supports in a bit. Something else too is that the pediatric team may not automatically speak to the adult team. So I think sometimes there's this assumption that the transition to transfer involves a hands-on approach from the pediatric provider, and often that's really not the case. And so this might be something that you need to advocate for if you feel that you need the pediatric neurologist or other provider to speak with the adult provider. This may be something that you need to work with your adolescent to facilitate. And something else to keep in mind is using the supports that you have while you have them. So in the pediatric setting, we're all here to help you with this process. You're not in it alone. So this includes social workers, nurses, and some institutions have a transition team. So children's for like medically complex patients who might have to transition to multiple different specialties has the Bridges team. So that's something to think about and ask about if you feel like you need some assistance. Moving on to the next slide, the Child Neurology Foundation has a really helpful guide for guiding this transition process. So this QR code, if you are QR code savvy and can scan it with your phone camera, it'll come right up on your phone. But I think we had the link to that. Hopefully Christine's able to put it in the chat. If not, I also have it and can add it. And I'm hoping that you all can follow along. I'm going to put it, I think I have it. Hoping you all can follow along with it as I talk through some of these next pieces, because does kind of set things up nicely. Just trying to put, Christine, do you have the link to the CNF toolkit by chance?
I do. We have it in the chat, right? Is that the one that you put right in the beginning?
That was other things.
Oh, okay.
I am trying to copy it from my thing and it's not pasting for some reason. Give
Oh,
me
is
just
it?
1 second.
And it's the QR code, correct? Do you want me to go ahead and put it right up?
Yes, I
Okay.
think I have it.
I can do it if you need to. I don't mind doing it.
Here it is. Okay, thank you.
Welcome.
Yes, so something just to follow along with. They've created a toolkit that I think is just a nice guide and hopefully helps give you a framework of kind of where to start. Um, so moving on to the next slide. Um, this is a timeline that I put together based on recommendations from Child Neurology Foundation and Got Transition. It is a framework or like a kind of a guideline to get you started. It may not look this way for you. The exact ages may vary depending on your situation and your child. And especially if you're looking at this and you're like, my child is way over 12, I'm behind. You're not, it's okay. And honestly, a lot of these things you may have already been working on with them. So way prior to actually moving your child to an adult provider, you want to start this kind of transition consideration process. And so starting at age 12, that discussion hopefully should come up in some capacity with your pediatric providers, and kind of doing some sort of baseline assessment of your child's understanding of their health needs. The Child Neurology Foundation packet has a health assessment tool, which I'm going to talk about in just a second. But that is a great tool to use annually to kind of assess your child's like what they understand how to do and where maybe there's some gaps or stuck points. There's also a caregiver version, which will help you too, to kind of assess the things that maybe you want to work on with them or that they're not going to be able to do on their own that you need to come up with a plan for. From ages 12 to 18, there's this ongoing idea of skill building for your adolescent to develop their self-management skills. And that's, again, an ongoing process that will probably continue after they transfer to an adult provider, but should start, while they're young. And I will talk about some examples of skill building. There's also a readiness assessment that you'll want to do with the neurology team, the pediatric neurology team, and you can do with the primary care doctor as well, or other specialists if depending on if your child sees multiple specialists. Really, it's supposed to assess. So I'm talking right now just about kind of the transition to adult healthcare, but you can include other members of your child's team to think about some other aspects too. So school might be involved to think about what their transition will be regarding education, things like that. And so this is like an annual review to assess any gaps in support and then leverage the community resources and services that you may need, which might include the Department of Developmental Services, behavioral health providers. And then as your child approaches closer to 18, you'll want to have that conversation around, between 14, 16 about legal capacity and decision making. And so bring that up with the neurologist or the primary care doctor, whoever you feel you have like a trusting relationship with that you want to have this conversation with, to talk about, are there concerns about capacity and decision making and what might be the recommendations for next steps? Because especially if a guardianship is recommended or indicated, that does take a little bit of planning before 18. So that's something that you'll want to prepare for. And especially, an adult provider is going to be a little less understanding and forgiving. I think sometimes in the pediatric settings, the teams continue to talk to parents and caregivers, recognizing that the child needs the support. But in an adult facility, without having something in place, there may be some gaps in care or difficulty. You might hit some barriers. So just something to think about. And then the last piece to this is the actual transfer and integration into an adult clinic. And I put an asterisk next to the 18 to 21 because while this is kind of the proposed ideal, this may not be the reality for your child and their situation. I know a lot of providers at Children's will see patients through age 22 through age 25, depending on, what they have going on. So this is a really personal decision that you would have that conversation with the provider while initiating the conversation about transition, when your child's younger, to understand, hey, like when should we actually plan for this transfer of care? And moving on to the next slide. So I have kind of some categories for promoting skill development, which I know we're kind of getting a little short on time. So I'll go over a couple of them, but I think that the slides will be sent out too, so you'll be able to review them as well. But essentially, during that piece of the timeline, the skill development portion, these are some of the things that will be expected that your child will be able to do and understand and manage by themselves in an adult setting. And so it's important to use the health assessment, which we can move to the next slide. Oops, sorry, forgot I had this little transition checklist in here. So this is part of the Child Neurology Foundation packet, which will help keep you organized, not something you have to use, but just something that will keep you organized in the transition process. But moving to the health assessment slide. So this is part of that kind of annual review that you don't have to do, but is suggested to do with your child to assess kind of where they're at and maybe where they need some more support. So this is an example of what is a benchmark for their own self-management. Can they name and describe their medical condition? Can they describe changes in their physical or mental health? Can they articulate their symptoms and the risk factors related to that? Do they know the risks of non-adherence? Do they understand their medication or the purposes of medical tests and procedures? So sorry, I'm just taking a second. So moving on to, I want to go to a couple slides forward, if possible, Christine, to the medication slide. Just to give you all an example of some things to think about. Yes, that's good. This skill building one is good. Perfect, thank you. And you can have them all appear. I don't know why it's doing that. So thinking about the skill building pieces, this is an example of how you might help your child if they're having some gaps in understanding how to refill a medication, so to speak. So a recent activity that we did with some teens from Children's with chronic illness was kind of helping them do this sort of health assessment and learning how to fill a med ended up with a lot of steps. And so this might be something that, you've been doing it for a while for your child, and you might not even realize like, oh, there's so many steps to this, and there's several different ways to do it. And so one thing that you can do with your child is sit down and kind of write out what the steps are, um, and break it down into more manageable parts that your child could then build on over time. And so maybe they start out observing you while you refill a medication for them. Um, maybe they move to kind of rehearsing it with you ahead of time. Maybe they write out a script that they then do with you in the room when they call to refill the medication. And then ultimately, maybe they are able to do it by themselves. Again, every child has different support needs. And so maybe that's one example, but maybe for another child, you are continuing to manage their refills, but maybe you set up a daily pill box for them, and maybe their kind of move to independence is being able to take their meds by themselves. So there's different approaches and different levels of support depending on kind of what your child needs. Um, Moving forward to the next slide, I want to just touch on the communication with providers piece. So this is a great way to start building some of the advocacy and confidence and some of the like independent management of their medical needs, is having your child start to meet independently with their medical providers. So starting even as young as age 12, some providers may want to meet independently with your child depending on where they are developmentally. And so this can definitely be scary for the child, and maybe for you too, if you're worried that they won't relay everything that you're concerned about related to their health. So there are ways to kind of build on this piece over time too. So, talking with your child ahead of their medical visit about the things that they're concerned about, and helping them to advocate in the visit. So maybe initially you're modeling the advocacy for them, and then you start to encourage them to advocate for themselves by helping them prepare for the visit, practice questions ahead of time, and gradually increase their involvement. And this shift of, you taking the lead to kind of pushing your child to take the lead a little bit. And eventually, maybe your child is going to visits by themselves. Maybe not. Maybe even when they're in the adult setting, maybe you're still accompanying them to visits. But it's just all about kind of figuring out where your child's threshold is for how much independence feels safe and manageable for them. I'll skip through the next couple. They are, again, benchmark pieces that will help you kind of get a feel for, is your child ready for this transition? It includes insurance, lifestyle choices. I want to land on the self-management piece, because there are a lot of great tools out there to help your child to start to manage these things independently. We know that teens want independence. They want to be able to do things on their own. And so giving them some tools to be able to navigate some of this, that maybe you've had a little control over, will help. So making sure that you have, you can do this together, is filling out a medical summary, which is within that Child Neurology Foundation packet. And that's a great thing for them to keep on hand too, because maybe they understand kind of their medical needs, but have a hard time communicating it verbally. And so having access to their summary is helpful. Having a medical bracelet, that might help increase their independence. And if there's worry about them, going off to school or going off to work by themselves, making sure that you have an emergency plan in place that's agreed upon, using technology. There's a lot out there now. So moving to the next couple slides on how to support your adolescent. So just some key things as we start to wrap up here. you should take care of yourself. It's very important. Um, Make sure you're enlisting your healthcare team to help. Um, you're not alone in this. So as I said, which actually I'm very sorry. I think I missed one slide I did want to talk about. Um, Christine, do you mind if I'm so sorry? I'm trying to be mindful of time. That's the slide that I would like. Thank you. Um, this is the plan of care form that's within the Child Neurology Foundation packet. This is what I was talking about a little while ago, that can help map out kind of transition related goals. So on this, some goals might be, um, refill medication by myself, or obtain guardianship, or identify provider. And so for actually identifying the new provider, again, this will be something that is discussed with your healthcare team, as to when and what age they would like the transition to happen. And this is something that you can collaborate on with them too, especially if you're not feeling like your child is ready. But at the same time, you have to sort of leave the nest at some point. So something to keep in mind. But the actual process of this transfer is that once you identify the new provider and schedule an appointment with them, you can advocate for that warm handoff. So again, it's going to depend on the health system that you're in and whether that's feasible, but it's a reasonable thing to ask for, especially if your child is a little bit more, medically complicated. And this may look like just a phone call between the pediatric neurologist and the adult neurologist. I know some models of care in other institutions try to have an appointment together. I don't know how feasible that is, but something to think about depending on where you live. And also too, you can ask about what resources are available in your adult setting. Do you have social work? Like, how do I access the nurse? So just thinking about the things that you already use in the pediatric setting and trying to apply them, to the adult setting, which again, there may not be the same things available. And that's why you want to try to supplement with resources in the community too. And so going to the next couple of slides. Um, so as I had said, make sure you're taking care of yourself and you're not doing this alone. Enlist your healthcare team. Use the resources that you have. Try to model some skills for your adolescent. Give them opportunities, and work on scaffolding their skill building and advocacy skills. This isn't something that is going to happen overnight, and I know it's scary, but if you eventually want your adolescent to have independence, if you continue managing things for them without helping them learn the skills, it will be harder for them when they are, out in the world. And it's important too, your child best, so help the team to understand their strengths and their capacities. Um, you know, really, really empower them and increase their confidence. Um, some additional resources. This was what was in the chat, at the beginning. That's the next slide, Christine. So as I mentioned, the Child Neurology Foundation, the Epilepsy Foundation has some really great worksheets and tip sheets. Got Transition has some really great guides and other assessment tools as well. The ARC has some workshops. There's the Supported Decision Making website, which has some really great tools. The Managing Epilepsy Well Network also has a lot of self-management programs. And then hospital transition resources can also be an option. So just for, I know we're right at time, and I'm happy to stay on if people have questions. So just some key takeaways as we're wrapping up. This is the last slide, Christine, I think right before the question slide. Perfect. So transition is a process that begins early. It involves the patient, their family members, the healthcare team, and their community team. So it takes a village, use all your supports. Um, Transition also includes considerations beyond just transferring to an adult provider, as I had mentioned. And then your role as the caregiver is going to shift over time. And so the goal here is for you to provide your child with the support and tools that they need to develop a sturdy foundation to build upon. Um, so I really appreciate you all for being here tonight. I know I sort of just sped through the end there. But again, happy to stay on if anyone has questions or would like to discuss anything further. And thank you, Christine, for piloting my slides.
Thank you very much. That was very informative.
Thank
Did
you,
I answer
Meghann.
your question, Candace?
Yes, definitely.
Okay, great.
There was a question earlier that someone asked about what is a medical ID. I kind of gave information about like medical identification, Joy, but I didn't know, Meghann, if you wanted to elaborate on what you've seen, or maybe what are some good choices, or what other parents, like especially for kiddos or adults that maybe have even sensory issues, like what could be some other options that maybe you guys have come across in your practice?
Yeah. So actually, I was just educated on this by like a 20-year-old a couple weeks ago. Um, your phone like has a medical ID in it. So you can put like your health conditions, medications that you take. And I think like there's some way if it's in like emergency mode that an EMT could open it and see like that information. And that's something that, of course, you'd want to talk about with your child, like how much of that you want in their phone. But it's just an example of something like if they have their phone on them all the time, having it in there might not be the worst thing. Something else too is you can apparently add your insurance card to your phone wallet. So again, for a teen that is like forgetting their insurance all the time or forgetting their card, like they could have it right in their phone wallet. Um, so there's a lot of tech out there now that can be really helpful. Um, so yeah, or even having their medical summary on them. Like if you fill it out, like either having it in an email on their phone that they can just pull up, or if they are someone that doesn't use a phone or isn't like using tech, but like carries some type of bag around, having a paper copy in their bag is also an option.
I know that when looking at my phone, I have an Apple phone. So if you have an Apple phone, it would be in your health app. And when you go into your health app, if you actually pick, I don't know if you can see, it's kind of bright. I know it's kind of weird. Your photo at the top, and it'll say health details and medical ID. And I actually just sent myself, I kind of took a screenshot of it so I could share with all of you guys. I'll put that in the chat. So that you guys can see it. Let me copy it. See if it comes up. Yes, it does. So it's kind of what, like, to set it up in your phone. So that's kind of what Meghann was talking about, the medical ID. So that when your phone is in a lock position, and you were to not open it up, and you were to get to the point, I think, where you have your code to get into your phone. Let's see, can we do it with it? Of course, I have a phone with the face, so it just wants to keep unlocking. So it doesn't help. I have to get my husband near me and try to open my phone. But again, yes, exactly. Thank you, Jordan.
Thank you, Jordan.
Yeah, so those are some really great ideas, Meghann. So thank you very much for sharing some of those medical ID pieces. So thank goodness for technology today, because I think that has come such a far way for people with
Seriously.
chronic medical conditions to be able to have those extra pieces there. Do we have any other questions for Meghann when she's here? I am going to be, all of the links that were in our chat, I'm actually going to save it right now as we speak, so that I don't lose them. And there it is. And I did have a question before. Someone had asked me that she She said, it was a question that was asked earlier. Even though I'm an adult, I still see my pediatric neurologist and haven't made the transition to adult care yet for my epilepsy. He wants me to feel 100% ready and be 100% um, with me for when the time comes, if that makes
Mm.
sense. I also have other medical issues. Is that something that is common or not?
Yeah, it definitely can be. Like I was saying, I think even at Children's, I have several patients I'm working with who are in their mid to late 20s. Um, I think it's a really individual um, process and decision, and it's a decision you can make with your neurologist. I think on the other hand, you may not you may not feel 100% ready at any point because your pediatric neurologist is kind of your comfort place in a sense. And so I think thinking about, that that the adult setting is going to be a little different. I think preparing yourself in that way and thinking about what you might need to help you feel comfortable managing your care, I think is helpful, and talking it through with some of your trusted people. And if helpful, asking your neurologist if they'll talk with an adult provider. I think, again, like I said, it's not uncommon that it happens that someone is, definitely over 21 and still seeing their pediatric provider. However, I think it's important to recognize too that training for an adult versus a pediatric provider might be a little different. And so there might be things that you need support with as an adult with epilepsy and other medical needs that an adult provider is better suited to help you manage. And so that's just another key thing to think about. But definitely you're not alone, and it definitely happens. Yeah.
Awesome. I don't see any other additional questions um, in the chat. But again, Meghann, we want to thank you again for joining us tonight. This is such a huge piece about it. Um, but exactly. And I had another question. Um, more just questions about, about going to their doctors and if they're not getting some of the questions answered that they should be getting. Um, what are some of the things that they should be doing?
Yeah. Do you mean if you're going to like an adult provider and they're not answering questions?
Yeah, or even a pediatric, if you're at a pediatric still and you're asking questions specifically about hormones or around the month, specifically with women, and having increase in seizures around their cycle, and asking that question and not being able to get a direct answer or getting that enough information, because like you said before, that's a perfect example of when the transition to adult female provider and epileptologist is somewhat helpful because of the fact that they may have more knowledge in those kind of areas and in those needs. Um, so would that be a great kind of starting off point to maybe start that transition with that as well?
Yeah, absolutely. And I to the thought that, you're feeling like you're not getting a straight answer, I think there are a lot of pediatric providers and maybe even some adult providers that are not comfortable navigating, especially the women's health related to epilepsy, because there's so much related to hormones and certain medications that may not be safe for you to be on. And I think providers are not as comfortable giving guidance. And so you may get a little bit of a runaround, and that's frustrating, I'm sure. So I think it's very fair to ask them, like, is is there another provider that I should be seeing for this? Because even before you turn 18 and need to transition, this comes up with puberty and things, which I think they can manage some of that. But I just mean these are questions that come up, and sometimes there are pediatric neurologists who may specialize in this or who may work collaboratively with like an adolescent medicine provider. So it's worth addressing. Um, and there are definitely other resources out there too. Like the Children's has like the Center for Young Women's Health is like an online resource with a lot of different like articles and things. Um, I'd say if you're in an adult setting and you're not feeling like you're getting your questions answered, it's very reasonable to bring that up and say, hey, I don't feel like you're hearing me. You can ask for another opinion if you think that that would be necessary, or even ask, is there a social worker I can speak to? Is there a nurse I can speak to? Just about what you're experiencing, because sometimes they can then relay to the medical provider, hey, this is the situation. Let's support this person better than we're doing currently.
Perfect. Thank you so much, Megan. Perfectly said.
Mhm.
Wonderful. Well, thank you guys so much for being with us tonight on such an important topic. Like I said, all of the chat information, all of those links that we shared will be emailed to you, including the toolkit, including the checklist, including all those wonderful links that Megan had shared with us tonight. That'll be shared with you tomorrow. But we are so happy that you guys could all be with us. Megan, thank you so much for joining us and enlightening us with such an important topic. And um, giving us your time. We know that this time is so important, family time, but thank you so much for joining us tonight on something that's so important.
Of course. Thank you so much for having me.
Awesome.
Hope it was
Everybody,
helpful.
I think it was. Everybody definitely, between the chat, everybody's saying thank you so much, Megan, for it. So thank you, everybody, tonight. This is recorded, so we will be sharing the link with everybody and all of the valuable information. And then, of course, our upcoming webinars that'll be coming up the next month. So thank you guys so much for being with us and have a wonderful evening.
Thank you.
Thank you.